Hello, Sean. Welcome to this podcast recording for the Wellness Lab.
Hello, how are you?
Pretty good. Thanks for making the time, the space to share with us all your knowledge and how you're supporting healthcare and making changes throughout the industry.
Thanks for having me.
Thank you. So, probably the first thing that we can get started with is a quick background of yourself, of what iuvoCare does, and enlighten us with a couple things that we can highlight for the audience to understand better who you are and what you do.
So, I was very fortunate early on to be the youngest member of a team that ended up seeing a company that started from nothing and ended up at that time being one of the largest acquisitions in software. It was about a $3.6 billion acquisition at the time by a company called Computer Associates. So that launched me into heading up a telehealth, or excuse me, not telehealth, but a telecom team that was doing consulting and financials. And that we built that from 2 reps to 200 over the course of about 3 years. And that got purchased by a European company later for a lot of money. And then for a lot of years, I was a sales consultant and then an executive for a worldwide hospitality company until about 9 years ago. I had a major health issue that I didn't think I had. I literally went out and worked out, came in and had a cough for a couple of days, which, sometimes you have phlegm and that kind of thing, clear your throat, no big deal. And I grew up in a household, maybe like many, where unless your arm was falling off, you didn't really go to the doctor. Fortunately for me, my spouse grew up in a household where if they had a sniffle, they were in the station wagon on the highway getting into the office. So she had contacted a nurse. I got a phone call. The nurse asked me a couple of questions, the last of which she said, well, when you cough, do you have phlegm and does it have any discoloration? My mom's been in healthcare for 25 years. She just retired last year. So I knew a little bit of medical, and I realized that she was trying to determine if it was yellow or green, it was infection. If it was darker brown, there was probably blood present, right? And I said, no, it's clear. So I thought that was going to be the end of the conversation. In the most clear voice you've ever heard, Lilia, she said, okay, Sean, I'm going to need you to have someone drive you to the nearest ER. If you don't have that person, I'm going to call the police car and have them dispatched to your house to come pick you up. I laughed, thought she was joking. She did not laugh at all back to me and said, okay, do I need to call the police? And I said, no. And I had my wife come get me. So long story short, I had my lungs had been filled up with liters and liters of fluid. They had to puncture my lungs. I had to do an emergency heart catheterization. And I got to see from the other side all the stories that my mom had been telling me of patients and the challenges that she had in our current healthcare system. So after I recovered from that, I was determined to get into healthcare and do whatever things I could do to make a more positive impact for that experience, not only for the hardworking nurses and practitioners, but also for and ultimately for those patients. And that's how I ended up with iuvoCare.
Oh, that's such an interesting story. So, how can you describe in one sentence iuvoCare, what iuvoCare does?
We are the adoption vehicle for products. We're the ones that help to not only get products that sometimes smaller clinics, mid-level clinics, or mid-level hospitals may not be able to get because they're not part of a giant conglomerate organization that has what's called a GPO, or a general purchasing organization behind them that gets them those products. But also, we are the ones that help them to give them superpowers, right? And we do that because we help them to help with process, and we help them to implement AI into their services. So that way they ultimately are able to spend more time with their patients and less time on all the bureaucracy that they have to deal with in our current healthcare system here in the US.
So for the sounds of it, maybe two things come out of this. You are leveraging AI to improve the healthcare overall way the operation is, and also helping with the system on how we've heard that it's a broken system.
Correct. Yeah. I mean, the challenge with our current healthcare system, right? It's not just that it's broken. It has a fundamental systems and adoption problem. So the systems that are in place are not designed for the benefit of the practitioner or the one giving the healthcare services to the patient. They're designed to be beneficiary to the insurance companies that are doing 90+% of the billing. So the challenge is right now, everybody's talking AI, AI. And the funny thing is when I talk to people, most people think that that's because they're using GPT. They think they're AI centric, right? Which we all know is just not the case. But the reality is you can't automate a bad system or bad process. All you're going to do is make that bad process clunk up faster and have more stopgaps. So unlike other organizations, we'll talk to them about how they want their process to be for their patients, for their clinic. And we want to talk about that first to make sure that we've gotten the processes down on the elementary level. And then we'll help them, whether it's an assessment, whether integration, or whether it's just providing them products that way will benefit them, so that way it takes away those stopgap issues that are stopping them from either helping their patients or helping more patients.
Perfect. Thank you. And then how is iuvoCare similar to Carvana in healthcare?
Yeah, it's interesting. So we keep getting that comparison, right? Because we know Carvana, really what they did was they made car purchasing seamless. So they took the friction out of it. And I think that's why we keep getting that comparison, because our goal and what we're doing is to have a system that takes out as much of that friction, whether that's from the manufacturer getting that product to the practitioner or the practitioner getting that product to the patient. So and I liken that to Amazon, right? My wife's probably gonna be upset if she sees this, but she's an Amazonaholic. So there's things that we could easily go into the store and purchase, but because Amazon has made it so easy and so frictionless, the drivers literally know my wife's name when they pull up. So we want to have that same effect. We're working very hard to have that same effect in healthcare, because the great thing is, a lot of these practitioners got into healthcare and are still in healthcare because they truly want to help people. It's just the hurdles that are put in their way that make it more challenging.
And for example, the solution you provide is for any type of clinic, like call it small, medium, or just so specific for a certain size of clinics?
So good question. So we, currently we focus on wound care, whether that's podiatry, whether that's Mohs surgeons, whether that is physical therapists who are extending, and doing wound care. So those are our primaries right now. Essentially, as we expand, my goal is that we're looking at all modalities, that we're helping in all of those ranges. And as far as the targets on the process side, there are some larger hospital organizations that we're, in discussions with now. But for me, what drives me is being able to help that single practitioner in a rural area, right? That mom and pop or that husband wife team that's got their own clinic, that practitioner that was in a hospital system and it just got to be too much and they really wanted to get back to having more time with their patient, that mid-level hospital that wants to have their own superpower so that way they can help. Because the reality is what we're seeing right now, even before whatever actual changes that are going to coming up in October and November of this year, we're already seeing the effects of CMS and HSS's changes, because we're seeing rural hospitals close, right? We're seeing major hospitals have major layoffs. It's not just affecting those practitioners. You're seeing that we're going to see millions of people who are not going to have the ability to get the healthcare that they need. So we're putting ourselves in a position to help to stave that a little bit. And I sometimes when I have discussions with people, I think it's like, the little boy that has his finger in the dam. But I think it's definitely worthwhile doing. And if we can help one practitioner or one patient, it's well worth it.
It's 12 o'clock.
And regarding the approach, do you take a cookie cutter approach, or what type of practice you have in place?
No, we see that so much, where people will come in and practitioners will talk to somebody and they know they need something fixed, and they'll come in and they'll pay them a lot of money or pay them a little money, whatever it is. And then the outcome may not be what they wanted, and then they skip off someplace else. So with us, we always pride ourselves on looking at, it's outcomes instead of overhead. So we want to come in and look at their flow first. How does your operation work, right? Your clinic is not going to operate the exact same as the one that's, across town. You may want to have deliverables to your patients that are different. So as I mentioned earlier, the first step that we do is we want to go in and observe. We want to see how you're doing what you're doing, because like anybody else, there's no way to help determine how to fix a problem if you don't accurately identify that problem. So that's the first step. And I think that makes us a little bit different. And a lot of times, when I talk to companies who don't know us or they're hearing about us for the first time, and especially if they say, hey, listen, you provide, wound care biologics or advanced AI technology for wound care. So all of a sudden they want to put you into a category and say, oh, you're a vendor, or you're a provider, or you're a consultant. And I look at that and go, well, when you talk about all those things and all those entities, in most cases, they're very transactional. So they'll do something one time or a few times, and then they move on to something else. With us, I liken us as we're an extended partner. So our outcomes are tied directly to that manufacturer providing more product, and it's tied to the outcomes of that clinician or that practitioner in their practice. We build that model so that way we're not going anywhere. We're very selective on who we work with. Number one, it has to be clinically reviewed and peer reviewed. It has to be FDA approved or whatever approvals we need in those territories. And it has to be something we believe that's going to actually work and benefit the patient ultimately. And that's going to be something that's ease of use for the practitioner. Because I don't care how great it is. If it's something that makes the practitioner stumble, it's going to die on the vine. They're just not going to use it. They don't have the time.
So for the sounds of it, you really ensure it's something that will suit their needs and will make their lives easier, support them in their practice, so that way the adoption will be inevitable.
Absolutely. And I love that, because you just used our line, we make adoption inevitable. That's great.
Yeah, I think the way you're explaining it and mentioning how it fits and how you work with all the providers and clinicians and whatnot to supply things and make these changes to maybe avoid disruption, it's the right way, and how you're really focusing and helping within the industry. And at the end, it's help for the patients, right? The care they're getting.
Absolutely. And for me, that drives every decision that I make as Chief Growth Officer for iuvoCare. That drives everything for me, right? It's got to be, ultimately, if it's not beneficial to the patient, it's just not worth doing, right? We look at one of our measurements of measure is client transformation. So to us, if you're not transforming the client in some way, all you're doing is taking invoices and cashing checks. That's the whole reason we got into this. So when we look at the marketplace, I see a lot of followers, right? And followers compete on price, but leaders compete and create categories. So we are 100% creating a category that allows people to adopt, right? It's a category of adoption, because if we fast forward 2 or 3 years from now, you're going to see a distinct difference. We're already seeing it. those practitioners that are embracing new tools, whether that's AI-based or some other things and new technologies, or that are looking at their processes and instead of trying to fix an old process, they're actually breaking that old process apart and creating a new process based on new tools they have available. Those are the practitioners that are going to have thriving businesses. Those are the practitioners that patients are going to go to, because we're already seeing it now, with the time it takes to call and actually get into a doctor's office, right? Patients are getting very savvy and they're shopping, right? They're shopping around. They'll call in and say, how long can you get me in? Who's the doctor? What's this? And they'll go, okay, thank you very much. Hang up the phone, and they're going to call the next practitioner. And we're going to see a huge gap where you're going to see those folks that are doing those things that we're talking about now are going to be leading that field at that time. And the ones that aren't either will be, let's say, on life support, if not no longer in existence.
Yes, totally in agreement. So this resonates or goes in line with the type of KPIs you care and you kind of measure and others might not, right?
Yeah.
So is there any other specific KPIs that you will say this is key for the adoption or the behavior we're seeing and how it's changing the industry?
Yeah, I mean, we look at sustainable growth velocity, right? SGV. So if it's something where, consistency wins the day. I don't care what you're doing, right? If you can go out and have a great workout on a Monday because you've been watching a movie and you're like, I need to get in shape, and it's 2 hours and you come out all sweaty and you feel great. But if you don't do that again, none of that matters. You get no gains, right? Versus if you go in and maybe a mediocre workout, it may be a low effort, but you're doing it 30 minutes a day for 5 days, you see those gains, you feel those benefits. Business is no different. So for us, that sustainable growth velocity is very important, because that's something we want to measure as a partner to see how we're enabling that, whether that's from the product manufacturing side or whether that's from the clinic side, on how we're helping to grow that, help that business to sustainably grow, right? The other part is we have a missionary versus mercenary score. So for me, as I talked to, and I saw this a lot last week at that conference that I attended, there were a lot of mercenaries, and I don't say that to put them in any bad light. They're very intelligent, very smart folks with one focus, and essentially with a mercenary, you come in and get them to fix a problem or to take care of a problem, you pay them and they move on to the next thing, right? We really want to convert people to being missionaries, and that's starts internally with our folks that we have, number one, but we really focus on our partners. We want to convert them to missionaries, where they're not just saying, hey, we want to stay in business with you. They're like, hey, we don't want to be in business with anyone else, because the reality is transparency builds trust. So we focus on being transparent on both sides of that channel, so that way they know they can trust us. And then obviously we want to be able to trust them. So, but it has to be extended first to the other person. So one of the things I talk about all the time, and one of my mentors said to me many years ago, and I've read in a few different books, is how much effort are you focusing on hearing versus being heard? And so we try to put that forefront, and it's tough. We're all humans. We all want to say what's on our minds first, but as a company and organization, we try to put that first to say, hey, let's hear before we try to be heard.
Thank you. Thanks for going more in depth with this question. And one of the key things that I think is relevant for this discussion and conversation will be healthcare sales has always been about people. Does AI replace that?
No, and that's good you mentioned, because as I have conversations, not just from the sales side, but also from the health practitioner side, I think there's a great amount of, I don't necessarily want to say fear, as I would say uncertainty. And so here's the way I look at it. It's a tool. If I'm, if my job is to cut down trees and I'm a woodsman and I've been using an axe for 20 years and somebody brings me a chainsaw, is the chainsaw going to replace me from cutting down the tree? No, it's just going to reduce my amount of effort that I have to put in. It allows me to be more strategic, and it allows me to get more output on the effort that I put in. That's exactly how AI is. It is there to augment the things that that human doesn't have to do, that we can take away, so that way the things that only the human can do are going to be able to be spent more time, energy, and effort in. And we'll see the benefits of that, not only as organizations, but we'll see it in our society, because the benefits that are happening ultimately for the patients, right? Plus, we'll see it from a practitioner side, because the reality is, like my mother, right? God love her, but many of those people got into it because they care so much. And that old saying of a drowning person can't possibly save another drowning person is true. So we have a lot of practitioners who are getting burnt out, right? They're so afraid of litigation, especially here in the US, on trying to practice. They are having more and more of the insurance mandates that are put on them. They're asked to see more and more patients, right? They're getting less and less reimbursement from Medicare and Medicaid. So with that, having the ability to have more time and to spend more time with their patients will help them mentally as well, which also helps the patients.
And you touched upon, like, from a strategic standpoint, do you have an approach on terms of that, specifically around partnerships you're building and creating?
Yeah, we look, we want to make sure that, number one, we don't ever bring on any competing partners, right? We don't want tools that are going to compete with each other. We don't want to do that to ourselves. We don't want to do that to our partners, and we don't want to do that to the practitioner. I see a lot of companies that they'll carry, 30 lines of a glove or whatever the case may be. So for me, on the sales side, I always find that tough, because once again, missionary versus mercenary, I don't know how I can convey my enthusiasm and belief in it if I've got 10 of them. So it's for us, we always wanted to make sure we had a suite that complemented each other. But what it also did was it allowed certain products who might never talk to a certain practitioner or modality and access to them, because we're an extended arm of multiple partners. So we may go in and talk to a podiatrist who never thought about exosomes or health and wellness products. So it gives a little entree that they wouldn't normally have with that cross-pollination. The other part is we really look, as I mentioned, for products that have been peer-reviewed, clinically tested, have the science and documentation behind them, have been cleared or being cleared for whatever current governance they need to have, and that they have a scope where they look to advance that product or enhance that product over the next 2 to 3 years. Because technology is moving so fast, AI is moving at the speed of light. So we want to make sure that it's a partner that's going to be able to grow with us, and we can grow with them.
Perfect. And just to confirm, what I'm listening or hearing from you is, like, supplies you're getting, this is from partners, and it's backed by strong science, clearance from the government and whatnot.
Correct. Yeah, we won't work with anything otherwise. We the great thing is I'm very blessed with our executive team. We've all been a part of larger organizations. One of our execs was one of the original founders for a little shoe called Crocs, which anybody who's ever seen a shoe has heard of Crocs. So we're very fortunate with that. Our CEO was one of 3 executives that helped grow Sir Richard Branson, the owner of Virgin Hotels, Virgin Airlines, Virgin Records, his company Virgin Pulse. and had a huge evaluation and buyout with that. So we've got a lot of experience as far as not only growing a viable brand, but scaling it and being able to extend it. So I think that's where we help a lot, especially with that target practitioner, that target clinic, because most of them want to get to a certain size, maybe not huge, but they want sustainability and they want to get to a certain size. And maybe they want to, a lot of times when I talk to them, they want to bring on other partners. They want to bring on a nurse practitioner or a few other doctors to add to their panel. So we have plenty of experience in helping them in doing just that.
That's great. So I think these last points that you brought to the table will help make the point, like if there's someone, a company that is nervous about outsourcing this important as it is, I think this will back up what you've been saying and how they can have that peace of mind of why you're providing a great solution that will be trustworthy, and they will not really regret any of this, and they'll have a better experience for their patients, right?
Yeah, and to your point, like a lot of people look at it as outsourcing, and our model is different. Like we don't look at it as outsourcing because we'll integrate with their CRM, their customer management system. They're going to integrate with ours. We truly come in as a partner. So, and in many cases, we will have long-term agreements. It doesn't mean we don't want to lock anybody in. What we want to do is actually free up access to those services and those tools for those folks. So in many cases, when we'll work with a partner initially, just because they've had those situations, a lot of times we'll start with something. We recommend we start with something short. We start with a 30, 60, 90-day project. That way they get a chance to see how we work. We get a chance to see how they work. And the great thing for us is it gives data, because the problem is a lot of these companies, they'll come in and they'll pitch something. And, the reality is if a company wants to have a product out into the marketplace in mass, they're going to have to commit anywhere from, on the low end, $2.5 million, on the high end to about $9 million to recruit, train, manage that sales team to be able to do that. The issue for that, number one, is time, right? You're talking, that could be anywhere from 120 days to, I've seen as much as 18 months, which is really long. Though also, I think that the challenge with that gets to be that if they aren't used to managing that process, it can be daunting. Plus the fact that when you pick a lane, right? I just read an article the other day where it talked about job hopping is now the new way to go for 30 somethings. And I looked at that and I go, as a gentleman who grew up where, it was taboo to hop jobs, but it made a lot of sense, is because it talked about the facts that they were getting multiple skills from multiple organizations that they could bring forward to their new companies as they move through their careers, right? And so the challenge for many of those companies is if they're in that modality, they're not getting those outside recommendations. They're not getting the outside information, because what's never going to go away is the value of judgment. AI is not going to replace that. AI can look at patterns. AI can retrieve you data. AI can even change my calendar and answer my phone call. But the challenge, at least for right now, AI cannot discern judgment. So that's where not only is the human in the loop is relevant and pertinent, but it's the same with businesses. They hire us because we have that experience and we have that judgment. And when you're that close, when it's your business, whether it's the manufacturer, whether it's your practice as the clinician, you're too close. You're too close, right? We've all had that experience where we've been in a relationship and our friends or family told us something about the person and we're like, no, you don't know them. You don't know them. And then later when it came to be true, they're like, we told you, and we just can't understand why we couldn't see it, right? Because we were too close. We wanted it to, we didn't want it to be true, so we saw what we wanted to see. And that's where having an unobjective eye come in helps you, because they're not too close and they can see all those things. And ultimately what it does is it's not a cost, it's a savings. The reality is the number of times we talk to practitioners and see the amount of income that they've lost or leaked out over the years is astronomical. Astronomical. And what I hate about that is it's not just the money that they're losing on their own personal income. It's those are resources that they could be putting into better tools to heal the patients quicker and faster. So
Totally.
so for me, that's a huge thing.
So yeah, I think one of the questions I had here is sometimes these will come to mind, right? Like, would doing this will just add cost, right? It will be like bottom line. Will you think it quickly, and you make numbers and think about what can happen down the road? Probably in a quick thought, you'll say this might just add cost to the bottom line, but feels like it's not. It's the opposite because of all the changes you do from a practitioner standpoint and the support you provide, the technology in place as well that is helping.
Yeah, absolutely. And and I get that a lot. Like, we don't have the budget for that. And for me, I'm like, hey, listen, I understand that, and that's okay, right? And I'd say this, whether it was our company or anybody's company, I'd say you look at it the same way. What are you currently doing to stop losing the money you're losing, right? And the issue that a lot of times is people aren't equating it into what it really is. If I have to have a nurse, a practitioner, a front desk person take an extra hour every day to do something, that's money. Like, that's money I'm not only paying that employee, that's money because I could have had that employee doing something else, right? So those are the kind of things that need to be quantified, that people need to get their heads around, to say, hey, this isn't an extra cost. What I'm doing is we're going to take that anything you would pay us or any other company that would help you with that, you're taking that out of the money that you're going to be making back from fixing the problem. And so when we look at it the other way, all we do is have pain for much, much longer. Right.
Yes.
And I always think of patients. So the reality is, and nobody wants to hear this, but that's okay. This won't be the first or last time I say something nobody wants to hear. But the reality is, most people know what they need to do, right? They have a vague idea, right? We know we need to eat vegetables. We know we need to have, 30 to 40 days of physical activity every day of our lives. We know we need sunshine. We know we need water. We know we need those things, right? But yet many of us don't do those things. But nobody ever looks at the average cost of a hospital stay for a patient in the US, right? Can range from especially if it's emergency room, can range anywhere from $20,000 to $75,000. What if I spent $10,000 to do all the stuff that I know I needed to do beforehand? I just saved myself $65,000. And I had a much better life quality. So when I talk to practitioners, clinics, whoever, that's my approach on it. And they may or may not agree, and that's okay, right? It's their business. They do what they can. But I just look at it less about quote unquote cost and more about what's the value being brought. And if the value being brought is a multiplier, because that's essentially what we are when we come in, we're a force multiplier. So we're going to help multiply not only your tools that you have, but your processes as well. And so the value you're getting from that should be multiples more than what you had for the cost. And like I said, we tie our model into making sure it's an outcome-based model. So that way we have a built-in viable reason to make sure that we're doing everything possible to help you to reach the outcomes that you want, whether that's monetary or whether that's provisionary.
Perfect. Thank you. Thanks for the great response. And one of the probably common questions, or it can be a concern as well, like, okay, I have staff, how much training do I have to allocate for them to adopt these products?
Yeah, I mean, in many cases when we're talking just the products, a lot of it they're using some of them something similar anyway. In most cases, when it comes to biologics and things like that, sometimes with some of the health and wellness products, the exosomes or peptides, those kind of things, they might need a little bit of training. But we always, once again, we always have adoption in mind. So a lot of times people come in and they'll do these 1 and 2 hour training sessions and that kind of thing. And I just know for me, I always think of me, in my brain, I'm out after about 30 minutes. Like I'm thinking about 17 other things. I'm just, there are some people that can do it. I can't. So for us, we try to do bite-sized stuff. We try to do 15, 20 minutes here and there. The other thing we find with that is there's less resistance and resonance from the staff when you do it that way. And it makes where as they learn a little bit and then they do a little bit and they learn a little bit more and they do a little bit more, the adoption rate is 2 to 3 times higher than when you try to force feed them everything all at one time. Because the reality is, as humans, none of us really like change. Even if it's positive change, we don't really like change, right? The average person drives the exact same way to work every single day. Because they don't have to do a lot of thinking about it. So I understand it, but it's the same way. When I drive to my local gym, I drive the exact same way. And I'm not thinking about it, but it's there, right? So we try to make it so we get them into the habit of those small bite-sized trainings for adoption. And we've just seen that it works so much better when we look at the responses from the staff. It's so much better. And as I mentioned earlier, if it's something that is going to take a big effort or a big lift from the practitioner or the staff, usually it just dies on the vine. It just doesn't, it could be the greatest thing ever. It could revolutionize their whole practice and make them have 40% more free time. But if you can't make it so it seems digestible, it's just nobody's going to do it.
Totally, and that's key, right? The adoption and helping with change, as you say. Change is something we resist as part of human nature, but it's something that as easy and digested you make it and it's seamless, then it will be at the end a great result. So that's great. You have that considered as well. So probably to wrap it up and summarize what we've discussed or just conclude, what's the philosophy that drives iuvoCare day to day?
I think for us is, if I had to put it in one, I'd say making adoption inevitable. We do everything to make it frictionless so that adoption is inevitable. Because as I've seen, when we can do that, it has truly been transformative for partners and practitioners. And so, as we've seen that with other businesses, think of any major worldwide global brand. It doesn't have to be healthcare, right? Think of, we talked about Amazon. Think of Google, right? There's something like 450 search engines that are well known on the planet, but Google made it so that it was easy for us to adopt, and so we adopted it.
And it's our go-to.
That's our go-to. You got it. So I guess if we had to look at one thing that sort of is a through line for everything for us, is making adoption inevitable. So that, because the way I look at it is AI is coming. It's inevitable, right? You can wait as long as you want. That's okay. I still got I still got friends, because I'm old enough to remember when the internet just became a thing. And I remember I was one of the first few people I knew that really got on it. And I remember downloading something and it said, it'll be downloaded in 9 hours. So I'm like, 9 hours, right? Come back in the morning, it was downloaded. I'm like, this is magic, right? And I had some friends who were like, I'm not getting on the internet. No way. Okay. I I got some of those friends now that they're on the internet, but it took them 20 years, but they got there. So I would just caution everybody that you don't have to want to become AI certified. You don't have to become a web architect. You don't have to become a coder. But what would be in your best interest is to have some sort of understanding of it, so that way you can be conversive. And as these tools keep coming out more and more every single month, I mean, I track them, like, and it's amazing. Like, I just got 200 more today that got sent to me. So they're coming more and more every single day. And to be able to know how to transverse those and navigate those and how to use them to your best of your abilities, you have to at least have a working knowledge of what they do or don't do. So for us, we make adoption inevitable.
Yeah, I love those words, and I do feel the same way as you do. It's part of a revolution that is here. AI is here, and it's up to us of being open-minded, of being receptive. And I know it can be overwhelming as well, that there's lots of things coming every day and bombarding us, but we do need to embrace it. We need to find where it fits and how we can use it to our advantage, because it's the right way to do it, to support ourselves and do the best we do, right? Like, as you mentioned, like for practitioners, what they're doing, they need to free up themselves from all these bureaucracy, from the operational side of things, many cumbersome items that are not really relevant to what their skill set is, and
Yep,
how they can really use it in their favor.
absolutely. And let me say one more thing. And with the AI thing, as much as I'm a proponent of everybody getting involved with it, the one thing I will say is there's nothing wrong with having a little fear of it as well, right? Because, sorry about that. So because the reality is that we've all seen that movie. We've all seen that movie. So there's nothing wrong with making sure there are guardrails, making sure that it's used properly, making sure that we are doing it in an ethical manner,
Totally.
and we're using that data correctly, and we're securing that data and housing it. So we always look at that as well, especially, I mean, I would look at that with anything, but especially with medical, with HIPAA concerns and everything else. So everything we do, that's already ingrained. But even beyond that, I always want to make sure that anything we're involved in, any of our partners are involved in, has those guardrails to make sure those protections are there. Because the reality is we don't know enough about it. It's moving so fast. It can't necessarily be something that we lose control of because we get too secure and too cocky of it, right? So there's nothing wrong with having some healthy fear and some healthy being a little healthy skeptical.
Yeah, especially in this field, it's great to have these caution barriers in place, and making sure patients and other people throughout the field are protected and taken
Absolutely,
care of.
absolutely,
Amazing. Well, I really appreciate your time, your insights, and sharing with us all the great things that iuvoCare has been doing and the change it's going to bring to the healthcare industry.
absolutely. It's been a pleasure. Thank you for having me.
Thank you, Sean.